Hello everyone. We are here today to talk about exercise medicine again and talk about the future of exercise medicine, including the in-person programs and how digital may be part of the hybrid model going forward. So really looking forward to talking to Dr. Liz Joy again today. So for those that don't know me, my name is Grace McNamara. I'm CEO of EXI Intelligence. The logic being that we want to bring the science to life and we implement the science around exercise science and behavior change in order to help people to be more active, to see more impact in health and healthcare. So really exciting times. Dr. Liz Joy, over to you.
Well, good morning. Thanks for having me. Yes, my name is Liz Joy. I am a family medicine and sports medicine physician. I've been very involved in physical activity assessment and promotion. I think my entire life actually, as an athlete and as a physician and a physician leader. And my work in this space has been, in partnership with many others, but really the development of the physical activity vital sign, in a large integrated healthcare delivery system. I'm currently chairing exercises medicine for the American College of Sports Medicine, and I chair the healthcare sector for the National Physical Activity Plan, which really seeks to help us actually implement the physical activity guidelines for Americans. In this case, in the healthcare sector. So this is something I'm very committed to, very active in, and I not only talk about it, but I definitely walk the walk. I'm standing on my treadmill desk right now. I'm not walking on it. It's a little bit distracting, I think, when people are actually walking and talking on a webinar. But I am on my treadmill desk, which I have at home, looking forward to our conversation.
Liz, thank you again for joining us. I think the two of us are as passionate as we can get about this topic and as passionate about getting people to move and helping to move the needle on policies and as well as practice and implementation and science and so on there. So yeah, thank you again. Let's start with the FIT Act, right? This has been, going around, I think, the houses for quite a while, and there's a lot of activity right now. There's been a fly-in DC in the last 2 days to amplify the message and hopefully push forward the agenda. So will you walk us through, Liz, a little bit of context of what is the FIT Act and how can it help people?
Well, we'll start by saying that it's PHIT, not FIT. So if people go to look it up, it's the PHF, and it stands for Personal Health Investment Today. And it was actually introduced into the House of Representatives in Congress back in 2018. So, I mean, it's been around for 6 years and it hasn't passed yet. I think it's been attached to a number of different bills that haven't quite made it. So it's not really been voted on as a standalone. I think it was reintroduced about a year ago. It has bipartisan support in both the House and the Senate. And I recently read that there are 61 co-sponsors in the House and 16 co-sponsors in the Senate. And like I said, bipartisan. So I'm hoping it'll pass. So why do we want it to pass? Well, the FIT Act would allow people to use their health savings account and their flexible spending accounts to pay for fitness-related costs. So things like health club memberships or fitness equipment, exercise videos, even youth sports. And it would allow people to use up to $1,000 per year as individuals, or up to $2,000 a year for families to cover physical activity related expenses. So it would be great because certainly financial barriers contribute to people not being able to access fitness resources, across ages. I mean, I think it's really a tragedy, that youth sports, for example, now basically require parents to pay, and it just kind of creates disparities for kids and barriers for adults.
Yeah, anything we can do, right, to take away the barriers that already exist. And we know cost in particular is a barrier for many. So it would be great for it to be passed. And as you said, this is the benefit that would benefit significant volumes and millions of people in the US alone. So
Yes.
be great. And like anything, I mean, with an international hat on, there's a knock-on effect. This is done well in the US. Likewise, other countries will see the impact and ultimately kind of follow suit if they're not already doing so. So there's a huge global opportunity with that. Can you link the two for me? So the EIM program and the FIT Act, likewise, the opportunity to leverage FIT Act for EIM also promotes the utilization as well as the affordability and hopefully access.
Right. Yeah, so Exercise is Medicine, is definitely a partner in the Physical Activity Alliance here in the United States. And, another area, that we have been working on, while we're waiting for the FIT Act to be passed is, trying to leverage some of the IRS rules, the existing rules, that might also allow for people to use flexible spending, health savings account, health retirement accounts to pay for fitness related expenses. And there is an IRS rule that would allow people to use those spending accounts to pay for exercise related or fitness related expenses if a physician or a licensed healthcare provider, could be a physician, nurse practitioner, a PA, writes a letter of medical necessity. So let's say, for example, that somebody has diabetes or back pain or depression. I mean, I can come up with a lot of diagnoses here that, they have not, this person may be sedentary and they have not been engaging in regular physical activity. Their healthcare provider could say, the best evidence, when it comes to, addressing, your mood disturbance would be to add regular physical activity. So I'm going to write a letter of medical necessity that would allow you to use your health savings account to pay for exercise related expenses. And they can submit that to the administrator of their health savings account, which is typically, probably a part of an employee sponsored health insurance plan. And they can be reimbursed out of their health savings account to pay for that. And those letters of medical necessity are good for a year. But man, nobody in the United States wants to come afoul of the IRS, nor do their patients. And so if people do go to the Exercise is Medicine website, they can follow some links to further information about the IRS rule. And maybe what I can do, Grace, is I can drop a link into the chat so people can access both information about the FIT Act as well as information about the IRS rule. And I think that people would find that particularly healthcare providers, but also, HR professionals and payers, so that they know that, this type of reimbursement is available.
That would be great. I do believe that there's maybe a lack of understanding of all of the resources and tools that can be used and leveraged. I mean, funds available as well. So yeah, absolutely, Liz, if you can share that link, we'll absolutely circulate that as well. Because there's a few different mechanics here, isn't there? Affordability is a big challenge. So the FIT Act will help, but already there is, going back to the fitness reimbursement we talked about, which a lot of employers would support already today. If the flexible spending account is also supported, FSAs are typically supported. We also have the health savings account typically supported, or at least by many. So there are definitely options. But as you said, the criteria is important here. So the IRS compliance is important. The letter of medical necessity is important. But if somebody has a diagnosis, getting a letter of medical necessity is definitely possible. And there's plenty of opportunity and spaces to do that. So people should and can do and leverage those funds that are available to them. So
yeah, and I think most people just don't know about it. I mean, there's a lack of awareness on the part of patients, people, and of their primary care providers. I mean, I've written lots and lots of letters of medical necessity, for things like, diabetic footwear, for example, or people who have emotional support animals in their lives. Those are the two that I think I wrote the most in the last couple of years. No one has ever asked me to write a letter of medical necessity for them to access HSA funds for exercise. But you can do that. And so we'll be talking more about that, at the ACSM annual meeting. And there's been a lot of notification of ACSM members, for example, that this is now available, and instructions in terms of how to do it are on the Exercise is Medicine website.
I think there's two big takeaways there. One is for anybody and everybody who's got a chronic condition to know that they can go ask their clinician to write them a letter of medical necessity, right? That's one. Everyone can know that. And likewise for exercise physiologists, whether they're delivering an EIM program or an alternative disease treatment for a person with chronic conditions, can also leverage these funds by asking their clients to go get the letter of medical necessity and leverage those funds, FSA, HSAs, and the mechanisms that are in place. And as you said, I don't think everyone knows that, because to your point, I'm working with exercise physiologists. There's two big barriers that come up all the time. One is getting a referral, right? Because I don't think clinicians understand what the EIM program is sometimes, and some are very up to date and some aren't. So, and they may or may not issue the letter, they may or may not issue a referral. And then the other is going back to the affordability. How can it be subsidized? How can it be available to the population who don't have the means to pay for it, but at the same time need and will benefit the most from it? So there's referrals and connecting the dots between the services and then the payment of it is quite an important two aspects for us to solve.
Yeah, and I think it is important too, and I think, you and I have talked about this before, that, for our patients who are of Medicare age, so 65 and older in the United States, if they are on a Medicare Advantage plan, which are often administrated, they are administrated by commercial insurers, they are required to provide a wellness benefit, or in most cases that translates to a fitness benefit. And I think many people are familiar with the Silver Sneakers program. It's, been around a long time. And I think there are thousands, if not 10,000 locations across the United States. But that's been generally, is a no out-of-pocket cost benefit for Medicare Advantage members. And other commercial plans will, maybe provide a per member per month or per member per year benefit to access fitness resources. So I think it's important for people, who are 65 and older, who tend to be the least likely to meet recommended levels of physical activity. I think it's around 11% of women and 15% of men are meeting physical activity guidelines if they're 65 and older. So there's a lot of room for improvement there. And then, for the younger set, I think it's important for people to also look into, not only their health insurance benefits, but other employee benefits. I know when I was working at Intermountain, not only did we have on-site fitness resources for our employees, but we also had negotiated reduced fee-for-service access to local commercial fitness. And some of our insurance plans actually had, again, a per member per year fitness benefit for people to use for, whatever they needed. If they wanted to access, digital, virtual fitness resources. Living in Utah, I think 72% of our state geography is considered rural or frontier, and so that means that people have to act, they're either walking in their neighborhoods, maybe riding their bikes, I don't know, but otherwise they're accessing, fitness resources digitally and virtually. Because, if you have to drive more than 15 minutes, to the gym, 15 minutes, if it's beyond 15 minutes, people don't use it.
Yeah.
Right.
15 minutes, right? And as you said, depending on where you live, it's significantly longer than that in many situations.
Absolutely.
That brings
even
us nicely.
Traffic.
Which is everywhere. And I'm in Boston right now. There's plenty of traffic, like anybody in Boston knows well. That brings us nicely, Liz, into the conversation around the exercise medicine programs and the way of being delivering them today in the past as well as in the future. So I'm working with lots of EIM programs. The vast majority, and pretty much all of them, have an on-site, service. They provide on-site, in-person solutions to populations and see great results. And as you said, now we have the complexity of those who have access, those who have the time, those who have potentially the funds to access. So, the way we've been working with some of the EIM programs is around how do we complement what you do in person in order to reach the people who are at home, who beyond that 15 minutes, or they don't have the travel, or they don't have the funds, in order to be able to connect the dots. Because as we know, we talked about this the last time, I think 78% of the US adult population are not sufficiently getting activity. There's 129 million people with chronic conditions, adults in chronic conditions in the US alone. So there's lots of people who should and can get phenomenal value from the EIM program. So we just got to connect the dots between them and hopefully reach more. So let's talk about some of the in-person programs. First of all, like some of the real pros here is amazing. Like the results are phenomenal. Like the results over the last decade, 15 years have been great. So the pros are great. Let's talk a few about the pros and just the cons of the in-person before we kind of focus into how do we look at a hybrid which complements what's already happening.
Well, I came from a healthcare system that had 5 medical fitness centers, that were staffed by master's trained exercise physiologists and EIM certified exercise professionals, that really did a lot of hands-on care and training for individuals who were generally older, who had multiple comorbid diseases, some of whom were frail, many of whom had fear, right? They're afraid that if they go out and exercise, they're going to fall, or they're going to have a heart attack, or they're going to have pain, right? And so the high touch, approach for people like that, can be really beneficial to kind of get them started.
Yeah.
So I do think that there's a lot of benefits for in-person, from a kind of a expertise and attention and safety.
Yeah.
I think another part of it is just the community that's created,
Huge.
right? They like, don't take away my Tuesday morning class, because we go together and we exercise together and then we go for a coffee.
Yeah.
Right. So I think the community that's created in in-person classes. I know, back in my aerobics days, that was so much fun. That was our social time, right? It was when we got together for an exercise class. So I think that's a pro of in-person for sure.
Hugely valuable. Yeah.
Yeah.
I think going back to when just like reflecting on that, when I started in the fitness world, again, too many years ago, when I was 15, the community aspect on a Monday and Tuesday morning, there used to be aqua aerobics. That group had the best social life. I was like, guys, this is so much fun. Like they were just amazing. And as you said, coffee and tea or a chat afterwards, it was their full morning. And the community aspect, they were a very healthy population. My understanding, some of them are still going, right? Like they're literally still going at the same times, doing the same activities in the same group, and they've all gone through tough life challenges. So it's more than just a physical activity. They're a support system for all of that life throws at them together. So completely agree. And the gym is a fantastic location to do that in, especially if you have a program that's designed and tailored for your medical needs as well as your physically and mentally. So yeah, no, completely agree. There's massive results there, research around it as well. So yeah, we're both big advocates of that.
I mean, I know you work with Dr. Brad Roy, up in Kalispell, Montana, and I've had an opportunity to visit his shop as well. And it's just amazing because they have created, an environment there that allows people to do pretty much any physical activity they want, whether it's in the pool or doing strength training or group exercise classes, aerobics, etc. And then they've got these social spaces, right, where people can, hang out afterwards, and maybe they do a yoga class, and then they're like, I'm still feeling good. Maybe I'll go and ride the exercise bike for a little while. They can get a coffee or a smoothie, right? I mean, I think that they really did recognize in building that facility that the combination of physical activity plus social interaction, is so good. It's good for our bodies. It's really good for our minds.
Right, right. And yeah, Dr. Brad Roy and our head of research, Dr. Lou Atkinson, will be doing a symposium at the ACSM conference in Boston here in the next in
Oh,
2 weeks'
fantastic.
time. So yeah, you're right. I mean, the results are phenomenal. I love that center, and thankfully we've been able to help extend likewise to the digital side of things as well. So yeah, he's fantastic. So let's jump on from that then. So we have the in-person, we know it's valuable, we know it's working, we know there's limitations around, say, just getting enough people and referrals and ultimately reaching that 129 million. So the part of what we're doing with EXI is, so just for those that don't know, what we've tried to do with EXI is we've brought in all of the research and science around exercise medicine, around chronic conditions and the safety factors in order to help automate the program where it's possible, and then complement the professional who's delivering an in-person care or is able to work with a person one-on-one. So we're trying to look at how do we, as you said, connect the dots of the people that physically can't travel or don't want to travel or aren't able to afford it. So how do we do that? So the digital, and I'm obviously biased because I'm a big believer that if we can combine people and people and leverage technology and communications and connections and validations, is we can hopefully reach more people to feel like they're in a community, even if they're not traveling into a facility itself. So likewise, lots of opportunities, pros and cons. So let's take a look at that for a second, Liz, because I'm a big believer, as I said, that we have so many people who either don't know the program exists, or they don't know how to access it, or they have barriers. So let's talk about that for a second. Digitally, from your experience, or from what's your thought process on where EXI fits, how it complements that in-person experience, and your facility that you're working with in Intermountain is amazing. Like it's top of the range. So talk to me about the tools you would have used digitally, pros and cons. What can we do different? What can we do better? How can exercise physiologists learn from all of what you've been able to do and achieve and see as the future?
Yeah, it's a great question. And one of my taglines is, people do not get well and stay well in the doctor's office, right? They get well and stay well where they live, learn, work, play, and pray. I borrowed the last line from Howard Coe, but
Still haven't learned that yet. That line is on my list of physically.
I know, live, learn, work, play, and pray. But the point of that is that, yes, whether people are in the doctor's office, I think in the US that the average adult has like 3 visits per calendar year, and maybe that's 20 minutes of FaceTime. So an hour total, right?
Mhm.
An hour total out of all the waking hours of the day, which is over 5,000. That means it's like 99% of our waking hours are not, in healthcare. Okay.
Yeah.
All right. So yes, there's no argument that people do not get well and stay well in the doctor's office. So I think from a fitness perspective, I think the average person who came into our medical fitness facility, was there, around 2 times per week, right? That's probably not enough, for them to really, improve their fitness substantially to impact, their health outcomes. I mean, yes, it is, better than nothing by a margin.
Yeah.
But what I have realized, and really, Grace, when you and I first met years ago, I was so excited about EXI because I realized it was a tool that helps people in that live, learn, work, play, and pray space. They can access it anytime, anywhere. It was built based on exercise as medicine. It integrates evidence-based behavior change. And, there's so many fitness apps that are available, on our iPhones, right? And most of them are not very sticky. There's been plenty of systematic reviews, I think even meta-analyses that have showed that, unless they integrate evidence-based behavior change strategies, they are ineffective. And so I think that if I'm going to recommend people, use some type of, digital resource for physical activity, I want to feel that it's safe, right? That there's science behind it. And the very first one I ever recommended was the good old fashioned 7-minute workout, right?
Yeah.
Right. That, was tested by some folks down in Florida. And I'm like, okay, well, this is, evidence-based. And I felt comfortable, sending people to that. But of course, it's then EXI came along. So I know we'll talk more about that, but I do think that having this is one of the most powerful tools that most of us carry around, even our most vulnerable, socially vulnerable patients are likely to have a smartphone, and meaning that they can access high quality information that allows them to engage in regular physical activity safely.
Safely. And that's one of the key words that we're emphasizing all of the time. And one of the challenges that I think, we see or at least I see with the world of clinicians, that time is really hard, and also expertise around exercise is difficult because not everyone's trained, right? And there's multiple complications, and there's different conditions and different medications and they affect and so on. So and again, exercise actually is a really, intelligent tool to look at how do we help encourage and motivate, but start people on a journey. Whereas what's safe for you to start with today? Let's not worry about the 150 for the moment. That seems like a big stretch for lots of people. So let's not worry about it. Let's start to wherever you're at today, because literally everything above that is a positive, right? So we need to move in, I think, smaller incremental work with you on the journey. And there's going to be good weeks, there's going to be bad weeks. That's okay. It's a journey and it's a lifestyle change that hopefully we can sustain over time. And that's a really important factor. And I think that's where, going back to your point about the in-person and going to the gym, 2 hours a week is 2 hours out of a very long week. And if we can do more active days, small increments, and we talk about exercise snacks and some of these other terms as well.
Yeah.
Bringing all that together and just join the dots between the support team, being the exercise medicine team or the physiologist team or the personal trainers, and joining that. What are you doing for the rest of the week? Let's help engage with the rest of the week, all day, small things, and hopefully, and I'd say hopefully, validate the activity. And we talk about the heart rate zone. It's part of the EXI program. So, Liz, as you know, it's that heart rate zone, that the safety that is safe for that person based upon the conditions and the medications that they're on. So we want to make sure that we're giving people an exact range for them, which gives people an understanding of, I understand the number of minutes to be active, I understand the number of days to be active, and the heart rate zone that I want to be in for health enhancing activity. And that's a big change, not just movement of any description, even though all movement is fantastic. But if we want to be health enhancing and we want to be looking at, cardiology and other conditions, and then let's get the safe zone for you. And mainly, we see that a lot of the time here is people try too much often in the first 6 weeks. They're eager, and then they get burnt out. They try to change their lifestyle too fast, or they get injured. And we want to absolutely prevent that as well. So, little and often, slow incremental changes. Let's build the confidence, let's build the lifestyle. Is super, super important. And, when we engage a digital solution, we can help people to understand throughout the week what to do. We can help people to not do too much too quickly. We can absolutely leverage then the data sharing with your likes of yourself as a clinician or the physiology and EIM team to say, here's what I'm doing. And then, am I seeing the results on my health improvements? Yes, fantastic. Let's support and validate and encourage. And if not, we have a conversation around what's going right, what's going wrong. So I think the huge opportunity there is safety is a big part of what we do. And I think it's a huge opportunity for people to really feel safe to be active. And to your point earlier on around, awareness, I'm not sure everyone understands that being active can be safe, because sometimes we have a perception of, you've got some complex health issues, let's be safe and be careful, which might mean do little or do nothing. And we've got to break that perception with a program, personalization, and hopefully this works where we get more people to be connected, personal, safe, adaptive, meets you where you're at, and then hope supports you throughout the day, throughout the week to sustainably change lifestyle habits.
Yeah, I just I agree. I'm like just nodding because I agree with just everything you said. And I recently did an interview with CNN where I told the reporter that the couch was far more dangerous than your walking shoes. And people get the biggest bang is when people go from nothing to something. And I think that's a really important message, for people who are watching this webinar, is that, yes, if we want to optimize the impact of regular physical activity, on health outcomes, optimize it. It's getting at least 150 minutes per week of moderate to vigorous physical activity, plus muscle strength training twice a week. I mean, but considering, only, 24% of American adults, are meeting that recommendation. And part of the reason why that number is so low is that the strength training engagement is so low because people don't know how to do it and they're intimidated by it. So if we can just again, give people the right information for them, personalize it for their resources, their health, their goals, they're going to be much more likely to engage and to engage safely and to make those incremental changes, so that they do start to reap the benefits of it in terms of, how they're feeling and how they're functioning. I recently heard a story of a woman who's, well in her 70s. She has multiple underlying health conditions. And she started to, get healthy, being more physically active, making some changes in her diet, doing some things to address stress, really engaging in a community.
Right.
And, over about the last 8 or 9 months, she talked about, I've lost 10 pounds. That wasn't her goal, but nonetheless, she lost 10 pounds. Then she shared that she was able to go up and down the stairs without holding onto the handrail for fear of falling. And then she shared that, her doctor, who is not me, but her doctor had taken her off 2 medicines that she had been on for a decade. Right?
Powerful.
So these were just incremental, small steps that she was taking. She didn't get hurt. She felt safe.
Yeah.
And she felt better. But I loved it that the health part of it, that's not what she talked about first. She talked about the fact that she was able to walk up and down the stairs without holding on.
Well, it's quality of life, right? I mean, as we are
Yes.
active, we have great quality of life, and that's life's for living. So
Yeah.
I'm very excited when I hear these stories, because these are more of the stories we need to be telling. So I'm delighted that we're able to tell the stories, get more of the data, back it up with qualitative and quantitative, and do it in a way that we're able to amplify the story for more people. So it's really, really powerful. So yeah, no, Liz, thank you for sharing that one. Conscious of our time, and what I want to be able to do is we've got a few kind of follow-up actions, I think, hopefully, that people can take away and to leverage the best of the time today. One is that we're going to be talking at the American College of Sports Medicine conference in the next 2 weeks. There's loads of content around the exercise medicine program. I'm looking forward to talking to a lot more physiologists around looking at the in-person program and complementing that with digital in order to reach more people at home with validated and validation, and amplify the aspect of personalization, safety, as well as adaptive people over the time, as well as where they're at home. If we look at the for the benefits leaders and the HR managers here, definitely one to look at is the FSA, HSA, and the FIT Act for sure. There is tools available, even if the employer sees that their current benefits aren't being leveraged. There's more there, and likewise an ability for more to be leveraged. We want more people to be more active, and if money is part of the barrier, let's try to take that off the table. Absolutely, and it's a win-win-win scenario. So people can come talk to you and I at the ACSM conference, and
I'll be there all week.
It's open to absolutely anyone. I think both of us are also, very open and available to talk to more people who are going to be helping generate the support behind the FIT Act, as well as support behind more people being more active for more impact. So we're like 2 open books here, Liz. Hopefully we'll the ripple effect will be huge. And then on a follow-up to this as well, for the exercise intelligence, we're working through another webinar right now with the Freedom Centre, which is a non-medical fitness centre, to look at the experiences of how they implement the exercise medicine program. At the same time, we'll be talking to Brad as well around the exercise medicine program in a medical fitness centre. So 2 upcoming conversations: medical fitness centre, non-medical fitness centre, and how it can be leveraged, how it can be implemented, and how it can be amplified for in-person as well as at home. So we're super excited about bringing more of the options on the table. Because Liz, if I just going to consolidate this down a little bit, one of the takeaways points for me is there's no one size fits all. Different people require different supports. So if we can create more support and more options, then hopefully we can find what fits for the people who need the support the most, and they can have a little bit of a flexible opportunity to do in person and or at home where they're virtually connecting their person and so on. So the more we do there, the better we can, I think, reach more people. That's my takeaway.
Yeah, I agree wholeheartedly. And and I like the idea of people doing a variety of activities, right? I think that has a number of different benefits. And it's not that, the people who are running 40 to 60 miles per week, to train for a marathon, go for it.
Go for it.
That's great. I think for a lot of people, though, having some variety in their activities, helps to make it more fun, to keep them interested and engaged. It may decrease their likelihood of injury.
Yeah.
And particularly, for the crowd that maybe has been either not active at all or intermittently active, maybe they just kind of haven't found their thing yet. But having a variety of things, like you ride a bike or you go for a walk, you do some strength training, you do some yoga, you play with your kids, you do some gardening, you take your dog for a walk, so I would encourage people to kind of mix it up, right?
Yeah. The beauty of it, as you said, is whatever the activity is, as long as you find one that you like and enjoy and can do regularly, it's a winner. So yeah, great takeaway for anybody at home who's struggling to be active. Every movement counts. So yeah, the couch is not safe. Let's get up from the couch. The shoes are good, and any activity, ideally fresh air, and if you can connect with people on the journey, it's an extra bonus. Community.
For sure.
Great. So Liz, there's a bunch of follow-ups there. Hopefully some key takeaway messages for people, regardless of whether they're a person struggling to get more active or a physiologist struggling to get more people into their programs and more people in more impact, or a HR benefits leaders looking to how do we fund this for more people so we can engage more of our employee base as well. So lots of, I think, takeaways and a huge opportunity to the next few months in particular to make sure that we can leverage what's already there, as well as push further support, which goes back to that Fit Act we were talking about as well.
Yep, absolutely.
Liz, thank you again. As always, a pleasure, and lots of messages. So hopefully they will be able to share this message to those who need to hear it.
All right. Thanks so much, Grace. Take care, everyone.
Thank you, Liz. Take care.